Good morning, everybody. Just pick up where we left off. Connecticut has one of the great healthcare systems in the world. I think that's publicly recognized. We also know that we're one of the more expensive healthcare providers. We also know, especially after a year of COVID, we've been reminded of the incredible disparities in terms of healthcare. And these racial disparities are a healthcare crisis. And these are three pieces that we're trying to address here with this legislation. And I can't get any legislation passed without legislators. I'm really happy to see Matt Lesser and Kerry Wood here, who are chair people of the insurance committee. So we're going to be working very closely together in terms of what we got to do. Charlie, welcome aboard, by the way. And it's really nice to see everybody's fallen in love with the ACA and Obamacare again. It was a tough 10 years. Everybody's always trying to beat it up. And now we realize that it really works. And we realize that it's cut the number of uninsured in this state by half. And now we realize that we're doubling down. And as Vicki and James said, with these incredible subsidies coming out of the American Rescue Plan, it's going to be much more affordable for middle class people earning up to $100,000. Dramatic reductions in costs, up to $6,000 a year in terms of what they have to pay for insurance. That's a big deal, opening that up. But as Vicki said, look, you can have insurance and you still may find that your healthcare is unaffordable given the co-pays and the cost sharing and deductibles and all the other things they're doing. We're trying to make a start at that. We've got a plan in place, funded at about $50 million a year on a recurring basis to help out those individuals and reduce their co-pays and deductibles to make sure that not just you have insurance, but you can afford to use it and afford to get the health care you need. I think we've realized this with COVID again more than ever. Healthcare is not just a right for you. It's really important for all of us that you be able to afford the basic preventative healthcare. And that includes testing and vaccinations. That's for your health and that's for our health. And I just say that often in the political world, they lead with subsidies, and I appreciate what we've described here in terms of the important subsidies that are going to make Affordable Care Act and insurance more affordable. We've also been tough in holding down the rate of increase in insurance rates. Vicki mentioned what we got on the benchmarking system. Josh Hirschman and our guys from insurance are here. I think we had the lowest increase in health insurance rates in modern history over the last year. Look, COVID and electable, surgeries and a lot of things are reasons for that, but it's also that we're paying close attention to these costs. And I do believe that over time, we're going to have more successes there as well. I just think the transparency and showing what those increases are and holding people accountable, Vicki's going to make an enormous difference. And you've been taking the lead there. And we got to deal with not just the symptoms of healthcare, but also you have to deal with the underlying cost drivers. And you heard mentioned, the high cost of pharmaceuticals, generic and others. And we're working with Charlie Baker up in Massachusetts to put in place a cap on the increase in pharma costs. And as Vicki said, that represents, somewhere in the order of 20-25% of overall costs. We're dealing with that, going to hold those down, make that more affordable for you. Matt took the lead on insulin, making sure that's affordable and nobody's denied on that in terms of life-saving things that we can do. I don't see Kevin Lembo here, but over in the controller's office, Kevin's been really taking the lead on hospitalization and costs and driving people to centers of excellence, using incentives so that you go to places where you have not just lower costs, but higher quality. And we give you incentives to do that. Deirdre is doing the same thing over at Public Health Department of Social Services, making a big effort in terms of maternity care and making sure we pay for value-based care there. We have a lot of work to do. 40% of our folks, I think you said that, Deirdre, born in Connecticut, under Medicare, under Husky, and I'm going to make sure they get the very best value we can. Deirdre's also working hard in nursing homes, going through a transition right now, making sure that we are paying for quality there. And finally, let me just end, where I started, which is equity. and what that means in terms of what we're doing in terms of vaccines, taking that to the community. We've got to do the same thing with healthcare. We got to make sure that not only do people know they're eligible for Husky, but we make sure that they actually get their a primary care physician, get their contact, get their federally qualified health center, reach out and make sure people have health care, can use it. We've got a lot of support from the American Rescue Plan. You know, for me, one of the things we're looking at is what we do with our schools and community-based healthcare in our schools, making sure that we can expand the reach in a variety of different ways. But I just want to, end, where I started, that Connecticut is taking the lead. We have the best hospitals, great insurance companies, and PBMs, but we got to drive in the same direction to hold down costs, make it more affordable for our families, make it more affordable for our small businesses, adding options on the exchange, reducing costs, and emphasizing quality. And with the team you see here, and now with Charlie taking the lead as chairman at the exchange, we're just getting started. Thank you.